Here at the Physicians Committee, we are always on the cutting edge of the link between nutrition and medicine, the link between health and diets. And so to stay on the cutting edge, we have to do a fair amount of research. We have to conduct our fair amount of studies. And we are running one particular study right now that I find just completely intriguing and fascinating, and that is a study on rheumatoid arthritis. And so I wanted to invite Dr. Hanna Kaliova and clinical research specialist and nurse Melissa Busta on today to talk a little bit about this RA study. Welcome. Thanks for being here.
Thank you. Thanks for having us.
Dr. Kaliova, let me start with this particular RA study. What is it that you're looking for? What are you testing?
Rheumatoid arthritis is an autoimmune disease that affects about 1.5 million people in the U.S. And it affects your hands and wrists and knees and other joints in your body, leading to pain, inflammation, and permanent damage to the joints. Now, there are some medications that may relieve the symptoms, but don't address the underlying cause of the disease. Now, research has shown that some foods may be beneficial for rheumatoid arthritis, and some foods may be harmful and, encouraging the inflammatory process. So what we're testing is the power of foods to reduce the pain and inflammation in people with rheumatoid arthritis using a simple diet, using a vegan diet.
I guess I could ask why, but I think that the better question is how debilitating is RA for somebody who's been diagnosed with it, who's living with it?
Within a few years, the disease may lead to a permanent damage to your joints. So you might not be able to do anything with your hands, so it might be fairly debilitating.
I guess that is the answer to the question of why then. Why study
Exactly.
this? And you said 1.5 million people have this?
Exactly,
That's
in the
a lot.
U.S.
That means that the three of us, we could probably count on two hands people that we know that have this. Well, you guys work with patients all day. But Melissa, let me turn to you. I want to ask you this. So somebody calls up and they're chosen to participate in the study. What is that process going to be like for them?
Yeah, so we'll be taking participants on a 36-week journey. We'll be testing out a supplement versus a low-fat vegan diet, excuse me, with an elimination component to that diet. So qualified participants will get a weekly support class where we'll be doing cooking demonstrations, taste testings. They'll also get free lab work. They're going to get their microbiome analyzed. They'll also be meeting with a rheumatologist and one-on-one consultations with dietitians.
And how long is this study?
36 weeks total, and it'll be starting in January.
Okay, 36 weeks. Okay, so that's a lot of free medical attention that you're getting there. That's a pretty good benefit.
It is nearly a whole year.
So suppose somebody's hearing this. They have RA themselves, or they have a friend or a family member who has it, and they want to pass this study along. What is it that you're looking for in terms of qualifying for this? Who's the ideal participant?
So if you have rheumatoid arthritis and if you live in the DC area, to be able to come to the classes and are at least 18 years old, then call our study number, 855-788-3918.
That number again?
855-788-3918.
Very interesting study. I look forward to hearing the results. Thank you.
Thank you.